So I had a patient post-surgical who asked me what their recommendations would be in regards to nutrition and even dietary supplementation in order to maximize his recovery. Uh, Pretty loaded question. There's some evidence that is continuing to mount that it gives us a little bit more guidance to make evidence-based recommendations for this, but this is also very much individualized. And so, what I want to present here is a document that attempts to simplify and synthesize what is the current best evidence in order to maximize recovery from exercise, increase lean body mass, and then also maximize one's recovery from injury and or surgery. So without going through the minutia and the details of each bullet point, I'll give you a high level overview of this document such that you could use it appropriately for yourself. So the first page is really just a checklist as far as like key components that will enable good recovery and optimizing one's physical performance outcome following said surgery. So we know that sleep is critically important. Minimum of 7 hours, going to bed at a given time and waking up at a certain time will help for good circadian rhythms. Dietary nutrition. There's several guidelines that I lay out here. Everything from caloric intake and potential surplus, as well as to protein demands, the amount, not only at a single meal, but daily, the timing, the sources of protein, carbohydrates broken down in a similar fashion as far as daily as well as timing, and then also within meals, in and around your exercise bout. Fat content and daily intake. We talk about I provide information about vegetables and even ancestral foods, selecting ingredients and spices consistent with those from your ancestors, hydration status, micronutrients, particularly vitamin C, A, and E, are critical for recovery from injury. Gives you some recommended daily amounts or RDAs for males as well as females, and the sources of the whole plant sources of where you can find them. All right, then I also provide the equation for predicting your daily energy expenditure, or your DEE, and then this is you're going to be your resting metabolic rate multiplied by your activity level multiplied by your stress factor. So options for RMR, or your resting metabolic rate, would be indirect calorimetry. Wearable devices can be used, but they're somewhat invalid as far as their consistency. Some models better than others. You can identify the source, the reference number 41 in the references list below. Or you can just use the calculations here. So based off your gender, or if you know your fat-free mass based off a DEXA scan or a bod pod, anything that gives you a relatively accurate reading of your fat-free mass can also be used as calculation. So you would calculate that. That would serve as your RMR. Then your activity level. Are you sedentary or extremely active? And then that would give you essentially a number, either 1.2 all the way up to 1.9. And then your stress factor. Is this a minor injury? Is this a minor surgery? Is it a clean wound that you're healing from? Is it a bone fracture? Is it an infected wound? Is it a major trauma or surgery, such as an ACL surgery or rotator cuff surgery or severe burn? And then you would populate each one of those variables and calculate what is your caloric demand or necessity in order to maximize your recovery. And then your macronutrient breakdown would be as described previously, with the protein, the carbohydrates, and the fat. So some examples, both a male as well as a female example. You can see that their RMR would be anywhere between 2,000 and just over that for the male, certainly less than that for the female. just given the smaller body size of this example. And then the macronutrient breakdown, given it in grams per kilogram of body weight, and the example amounts. Okay, then dietary supplementation to help to further bolster your recovery. So there's a whole slew and a multi-billion-dollar industry around supplements. I've tried to synthesize it down into the best evidence-based ones, specifically for maximizing lean body mass and injury recovery. So creatine monohydrate, I give the dosage, the purpose, the timing, different brand recommendations, as well as evidence-based resources, not only hyperlinked there, but each one of these are end notes. So you can click on it and it gives you an annotated bibliography further down in the document. And you can just toggle back and forth by double clicking on them. Hydrolyzed collagen peptides, really good for joint, cartilage, tendon, and connective tissue regeneration. Vitamin D, critical for not only bone, but also immune regulation and skeletal muscle function. Amino acids, important for anti-inflammatory properties, mitigating non-communicable chronic diseases, improving cognitive function, and preserving cell wall fluidity and function. Beta hydroxy beta methylbutyrate, or HMB. This is helpful for preserving lean muscle mass. It's a metabolite of the amino acid leucine, which is critical in stimulating the mTOR pathway, particularly in those instances of immobilization, or in the older adult, or if you're caloric restricted, or if you're predominantly using plant-based protein diets or sources, then this would be recommended. However, it may not be as necessary and doesn't have as strong evidence as such as things like creatine if you're already getting high quality protein sources throughout your day. And then in a similar tone is essential amino acids. Again, if you can get these from whole food sources and you already have a really good, rich, well-distributed protein regimen, then this may not be as necessary. However, it can be influential in certain instances and circumstances. Probiotics, this is maybe one of the more up and coming and even potentially even controversial recommendations as far as being sound evidence-based. But this being said, it has shown to be recommended in order to help to bolster immunity, reduce the potential for post-surgical infections, as well as helping to repopulate the gut from the antibiotic regimens that can occur following a surgical intervention when people are put on antibiotics to reduce the risk of infection. Can also help with bioabsorbable of other nutrients that you're taking in. Okay, so what does this transiently, actually look like? So we have the daily meal plan listed above, and then you have kind of the more localized bolus in and around your rehab, or you can think of this as your strength and conditioning regimen, depending on what stage of rehab you're in. And this is how you would equally distribute your protein content throughout the day. Additionally, you have this RSB, which is your rehab supplemental blend, either pre and post your workout regimen. And you can see that this includes several of the recommended supplements listed above. If we're really trying to optimize the nutrient timing in and around your rehab. Here's another graphical abstract of a paper that I cite throughout this article or throughout this document, right? So it just kind of simplifies it and summarizes it down. Energy availability be higher, approximately 20% during the early phases, especially during severe injuries, that is in major surgeries such as ACL. Around 45 kcals per kilogram of fat-free mass per day will contribute to optimal energy availability. High protein and high carbohydrate diets are often beneficial for tissue healing, tissue repair, and reduced inflammation. As described above, this is really just a summation of a lot of the recommendations that were previously made in this document. Finally, one of the, not quite finally, but one of the things I also include is just the bullet point summarization of the International Society of Sports Nutrition Protein positional statement in regards to building essentially the protein recommendations for healthy individuals and exercising individuals for building lean muscle mass. It just reinforces a lot of what is otherwise described above, but I like that it's put out into a bullet point format, and then it has I've hyperlinked again via the references, so you can just double click on that, and that will allow you to pull up the article if you so choose. All right, then we can't neglect what is the training recommendations. So here is just a summary of some of the key milestones and, or not milestones, but key principles when it comes to strength and conditioning, particularly the resistance training, variables and how you want to optimize this for muscle hypertrophy and recuperation following your injury and in order to reestablish your prior level function and muscle performance. Finally, I end with a couple additional resources. So ISN papers. So this is the International Society of Sports Nutrition. Their website. They have a whole. They've listed out all their positional stances, not only the protein one that is listed above. Third-party testing companies for any supplementation that you so are questioning. You can go through any one of these. I give a little bit of a spiel about animal versus plant-based protein, as this has been one point of controversy by some of the experts and the giants within the field, everyone from Dr. Walter Longo to David Sinclair to Dr. Peter Attia. They all have given their insights onto this as to what their recommendations would be from protein-based sources. So I try and at least provide a candid layout in regards to longevity, as well as the bioavailability of certain proteins from animal versus plant-based sources. Finally, what I lay out here is the evidence-based recommendations for maximizing hypertrophy for natural bodybuilding. So if we're going to really try and recuperate and maximize your body composition, then we want to train like those who actually do it for a living. And so this would be a recommendation if you're trying to increase your muscle mass during your essentially what would be the off season, but then also simultaneously looking at trying to cut down on your if you're going through a cutting phase where you're trying to optimize your body composition once you've actually like bulked up, particularly hopefully within the acute phase of your rehab, where you're going to be dropping about 0.5 to 1% body weight per week to maximize your lean body muscle retention so that you can establish what is your desired body composition. And then the references, and the references aren't just listed, but they're also hyperlinked and they're also annotated with additional information. If you're wondering where this information falls relative to the document and the information below, all you need to do is double click on it and it would bring you to that particular content. All right, so that is the document. I think that it gives a really nice overview of everything that you otherwise probably need from a nutritional standpoint and recommendations. I'm trying to synthesize, obviously, a lot of information into a single resource, but I hope that it provides you the guidance that you need in order to maximize your outcome.